Well, folks, hello, come on in. Okay, let's go ahead and get started. And I am going to minimize the chat area so that way it won't be distracting to me as I'm teaching. And we're going to be talking about today RPM, remote patient monitoring to the rescue. This is one of the things that Medicare came out with a few years ago. Well, AMA came out with a few years ago. They got everybody excited because it's making a real difference on patient care. And I'm going to go over that, but it's also making a huge benefit to the practices and the clinics right here. Now, first off, I want you to understand I am not an attorney. I have watched all the episodes of Boston Legal, and I'm not a doctor. And I did watch all 112 episodes of House on television, but I'm not a doctor. I'm not an attorney. So this is not legal advice or medical advice. I have been teaching these webinars and seminars for more than 40 years. And yeah, I'm an old guy, obviously, as you can tell, and written some books on these kind of things. And I would be more than happy to speak for your local association, local group, whenever you need us to. Okay. First, I want to make sure we're being compliant. There's a lot of companies out there offering different kind of services, whether it's RPM, chronic care management, annual wellness visits, etc. By the way, you cannot job out annual wellness visits to anyone other than your own employee, by the way. But one of the problems is a lot of practices, they're basing how much they charge you on how many billable codes you get. And that is basically tying it to the volume and or the value. And that would be a violation of the anti-kickback statute per attorneys that I know that used to work for the Department of Justice, and their job was to put people in jail. That's why I did not set up our program that way. You always got to make sure that you're questioning these kind of things that you're hearing from these salespeople coming in, because not everything you've heard in life is true, by the way. As an example, which is the most effective way to brush your teeth for a right-handed person? Is it your left hand? Is it your right hand? Well, the truth is, it's neither hand. It's a much more effective to use a toothbrush than your hand. Okay, so you always got to question things, people. That's just the way things are. You also can't do a percentage basis. And I can't tell you how many times I've had people over all the years say, "Hey, Don, I'll give you a percentage for however much money you make us in consulting or in RPM, et cetera." And I would love to do that because most of my clients in the consulting side sees hundreds of thousands of dollars a year on income increase, and the same thing with RPM. But we cannot do that. That is a violation. Now, I wouldn't get in trouble personally, but you would. And in 40 plus years of doing this business, I've never gotten anybody in trouble yet. And I want to make sure we keep it that way. So if you don't know about RPM, it's been around now for about 6.5 years. Medicare started covering it back in January 2019. At that time, I figured out that doctors, instead of having to go out and invest about $50,000 each to try to get into a system and set it all up and reinvent the wheel, they needed help. So I invested hundreds of thousands myself and created this company. And I like to be totally transparent with everyone. I do own Telecare USA 100%. In November of that same year, Medicare came back in and classified this right here as what's called care management. That means that you can now pass through billing. In other words, you can pay a company the same way like if you might be paying ChartSpan or another company to do chronic care management. That's been around since 2015. You can now do that as of November of 2019 with remote patient monitoring. You cannot do that with annual wellness visits. You cannot do that with ultrasounds and other things like that, because only services you can do pass-through billing on, by the way, is RPM, remote therapy monitoring, chronic care management, and APCM, advanced primary care management. Those are the only 4 care management services that Medicare allows you to do what's called pass-through billing. So you got to be careful. Again, the sales reps will come in and tell you anything. Be careful. In July of 2023, Medicare bumped up the MUEs from 2 to 3, meaning you can bill out 3 charges of 99458 if you're meeting those guidelines. So you always want to make sure that you're keeping track of all this. And that's our job. You said to yourself, well, how does this make a difference with the patients? Well, in 2023, they published a report in November of 2023 that showed a reduced mortality, 34% reduction in all cause. He also had 22% fewer all-cause hospitalizations and 21% fewer cardiovascular related hospitalizations. But think about it. If you can help keep 1/3 of your patients more alive, or keep more than 1/3 of your patients alive out here, that's huge. And this was out of more than 5 million patients in the tests that they did. So you really want to be using this right here. And that's why Medicare and the other carriers keep throwing more money at it, because it's helping save lives. And that saves them money too. By the way, all commercial insurance was supposed to cover this, especially Medicare plans. I don't know if you know it or not, but Medicare plans sometimes will lie to you, and they'll tell you, well, we don't cover something like UHC WellMed. I've turned them into CMS. I'm waiting to see if they can get fined. I know that there's three different Senate investigations into United Healthcare right now for violating the rules. Because remember, if Medicare Part B covers it, Medicare Part C is required to, with everything except hospice. So be careful which Medicare plans you're listening to. And by the way, that's a whole nother webinar on how to fight the Medicare plans. By the way, folks, just a couple of years ago, there were 65 million Medicare patients between Part B and Part C. Only 6,000 medical providers in the country billed out to Medicare that year. I know I've got a list of every single one of them because it's public information. And I can tell you how many times each one of them billed what codes. The sad thing is only about 151,000 Medicare Part B patients received RPM services in 2023. Medicare keeps stressing they want you to do this because it not only saves lives, but it saves them money. If they can keep somewhere between 34 and 38% of Medicare patients out of the hospital, or 25% fewer ER visits, they would much rather pay you a couple $100 a month per patient than have to pay for one hospital stay. I remember years ago, about 3 years ago, I was hospitalized because of the COVID vaccine thing, and it dropped my blood pressure. And just one night in the hospital cost Medicare more than $19,000. And yeah, I'm on Medicare because I'm an old guy, by the way. And yes, I'm also on traditional Medicare because I'm smart. Now, you need to understand when we're talking RPM, it doesn't mean that you can sit there and use the Apple Watch. I have an Apple Watch and it checks my blood pressure, but that does not meet the guidelines of a medical device. So we use nothing but medical devices. We do blood pressure and glucose, and we have those that hook up with the patients with Bluetooth, which is important if you're talking about younger folks who like to carry their phone everywhere. We have scales, and we also have a blood pressure and glucose machine down at the bottom of the screen right here that has SIM cards inside it. So the patient doesn't have to have an internet, they don't have to have Wi-Fi, they don't have to have a smartphone or anything. Because sometimes us older folks on Medicare, all the technology escapes us. And we also do pulse oximetry for our pulmonary patients. Now, there's 4 CPT codes that you're going to use most often. And with Medicare and commercial carriers, these are the 4 you're going to use. If it's Medicaid, you want to check with your state Medicaid carriers and find out if they prefer to have 99091 or if they prefer the 994 series codes. The 99453, as you can see, is basically setting up the patient. 99454, though, is where you are providing the equipment to the patient that we put in there on your shelf in your office right there, and you hand it to the patient. And the patient must do this year 16 days of testing in order to be able to bill it out. 99457 is at least 20 minutes in the month. And our staff last month averaged 67.2 minutes. So most of our patients ended up getting I'll show you in a few minutes what kind of money they got. But 99457, again, also requires what's called an interactive communication. There's some RPM companies out there that are fantastic. There's some, though, that are not meeting that interactive communication that is required as far as 99457. And so you've always got to want to make sure that you're doing everything on the documentation that's needed to make sure you stay out of trouble with those. And then the 99458 is each additional 20 minutes. Interestingly, 99458 is what's called a midpoint code. Now, I'm a certified professional coder with two different associations, AMBA and the AAPC. And whenever we're talking about midpoint codes, that means you must meet and exceed or meet and or exceed the midpoint behind that. So this right here is one of the things you need to make sure you understand is what can you code out? And so if you're billing out 99454, 57, and 58 each month, that can make a difference to your practice income, especially if you're able to get multiple 99458s. One of the big questions we get asked quite often is, what are the LCDs say? Local coverage determinations, or what they also updated those in what's called articles. What diagnosis must be on the claim in order to pay for it? As of this month, that we have not seen in the last 6.5 years, any of the carriers issue LCDs. So that means it all falls under what's called medical necessity. Typically, most of our patients that we're monitoring around the country have diabetes or hypertension, or they may have hypoglycemia, hyperglycemia. They may have cardiovascular disease. They may have pulmonary fibrosis. They may have asthma, or they may have COPD. Patients being monitored on the scales might be morbidly obese. So they may be congestive heart failure patients that you're trying to sit there and monitor how much the Lasix needs to be based on their current body weight. And the nice thing about all this data is it gets transmitted in instantly whenever the patient does the test. No more does the patient have to write it down and maybe sometimes lie on their numbers or fib on their numbers or forget to write them down or forget to bring them to the office. This way, the provider can get updated instantly on this stuff. Let's talk about finances here for just a moment. Let's say you send a blood pressure monitor home with a patient. And stress to that patient, we want you to test twice every day. Like, for instance, whenever on my own doctor, whenever my cardiologist saw my numbers, she said, I see from out here in the mornings, this is your average because it shows the doctor the average. This is your average at night. I want to make a change on your metoprolol. And that makes a big difference right here for the provider to be able to know what time of day it was as well. Now, you sit there and say, let's say we have a 99453, 5457, and 58, but on a ongoing monthly basis, you got a 5457 and 58 because the 53 is only one time. That means your average allowed amount is going to be about $133 a month around the country. Now, some places like New York, California, Alaska, it's going to be a lot higher. You go to places like in White House, Texas, where I live, or Mississippi or someplace, and it's going to be a lot lower. But that's why we average out to these numbers. And if you're paying us $77.10, which is a flat rate we have because we have to make sure you stay compliant, your net profit is going to be somewhere between $56 and a little bit more than that. On a year's basis, that's about $672. Not bad. But last month, as I said, well, in July, we averaged 67.2 minutes per patient. So most of our patients had 2 or 3 units of 99458. So where are you at if you get 3 units on that right there? Your net monthly profit is about $134 on average. That means your net profit yearly is about $1,600. That can make a big difference in your practice. Again, we're not doing this for the money. We're doing it for the patient care. As I mentioned earlier, 99091, some states require that one, that code, because that's an all-inclusive code. Like here in Texas, I believe Medicaid pays like $187 in Texas for that. We have clients in Indiana. We have clients from Hawaii to New York, so all over the country, it seems like. So again, you want to check with yours. And as far as the numbers goes, the doctors need something that they can see and be able to see, like you notice right here on 531, this particular patient right here had an abnormal heartbeat. So if we have the patients having abnormal heartbeats, the providers need to know that because that can make a difference on the patient care. And they also can get some really cool graphs that they can look at and see, is the patients higher than they should be, lower than they should be? And that's very impressive to the patients and helps compliance, because if they can sit there and say, diabetic patient, I see every morning your numbers up here and every night they're over here. I think we got to get you to stop doing that donut every morning. Or over the last 3 years right here, we can see you've been gradually coming down. So you're getting to where you need to be. And that encourages the patients and that helps compliance. Because again, if we can get the patients to be more compliant with their medications and with their patient care and their diet, it's amazing what can happen with patient care. About billing, occasionally I'll find somebody out there telling me, well, we do the billing, an RPM company does the billing for us. I don't recommend you let anybody do the billing for you except your one normal biller that normally does it all the time for you. By letting somebody else do it, you could be putting yourself at a lot of risk. And I believe there's inherent problems letting another agency go out and do the billing unless they're your own billing agency. Often someone asks us, hey, will we do the billing for you? No, I won't, but I'll work with your biller. I'll teach your biller. And on about the 4th of each month, we're going to give you and your biller a report. That biller report is going to show you exactly which codes you can bill out. This is an actual client's billing report. This right here is a particular nurse practitioner in Grand Prairie, Texas. This was the first year she was using us. And you'll notice over here, it's got the codes, it's got the patient name, which by the way, I have changed because of HIPAA. We really are not taking care of Alan Jackson, William Shatner, and Jim Croce. Of course, Jim's not even with us any longer. Hasn't been for a long time. But you got set up date. We got over here how many days of testing the previous month. We also have over here how many minutes our staff and your staff spent. You said, wait a minute, your staff does this? Yeah, we do as much or as little as you want. Most of our clients, 92% of our clients have us do everything for them. Occasionally, they'll sit there and say, well, I want to take over because I enjoy having that interaction with the patient. Cool. Well, they may start off and say, my nurse is going to be able to do this right here for you. For me. And so the nurse is the one checking the numbers and calling in. And the first month, that may be great. You might be getting 40 minutes. Second month, probably down to 30. Third, fourth month, you're down to 16 minutes in the month because that nurse you have is busy doing everything else too. And that's why sometimes people will start like that and then they switch over to us and say, you were right, Don. We want you to handle it all. By the way, good news is next year we're getting new CPT codes, 2 new CPT codes, one for 2 to 15 days of testing. And then another one right here is going to be for a minimum of 10 minutes in a month instead of a minimum of 20 minutes in a month. The more codes that Medicare and the AMA are throwing at this right here tells us this is something that they're wanting to build on because it's helping patient care. And overall, it's saving them money, as I mentioned before. Now, notice over here that's something that's kind of interesting. You'll notice we tell you which CPT codes to bill out based on the current guidelines and based on my coding knowledge. And so our staff does that, and then it tells you whether or not we bill you or not. You scroll down here to Bruce Wayne, and you'll notice we didn't bill them for Bruce Wayne at all. Dr. Martin right here was not billed because but down here, you didn't have a 99454 or a 57. And if there's not a 54 or 57 billable, then we don't bill you. We do this to make sure we're keeping you out of trouble. And everything we do is what's called cash positive. You're only paying for our devices once they're making you money. I can't do a percentage basis, but I can say if we're not getting you a 5-4, that means that we didn't bug the patient enough to get them to test 16 days because we call the patients for you on your behalf. Or if we didn't get at least 20 minutes, we didn't spend at least 20 minutes documenting the phone calls and the contact and the numbers we're reviewing and reaching out to you, et cetera, then we don't deserve to be paid either. So that way we're going to make sure that you're getting paid. And we send this out to you on around the 5th of each month. And then on the 25th of each month, we process the ACH or the electronic check for the previous month. That gives you time to get paid before you're paying us. Again, we understand the kind of cash flow issues you have. I've been consulting with doctors now this is my 41st year since I started back in 85. And we want to make sure we take care of you. In fact, we live by Matthew 7:12, meaning that we basically treat you the way we want to be treated. And that's very important to us. That's the way I run all my businesses. You can schedule a free 15 to 30 minute Zoom call with us. on this right here. In fact, you can pull out your phone right now and just click on that scan me and call it. Where does that take them if they go to scan me? They're not seeing pictures of my dogs and my animals, are they, when they go there?
No, they are not. That will take them to your schedule link. So it will take them to your calendar link. Sorry.
Okay,
Mhm.
well,
Yeah.
fantastic. Okay, super. And you can also email me, donself@donself.com, if you have any questions or if you need to reach out to me on this. So we'd be love to handle any kind of questions you have on that. Uh, we have 2 more weeks of additional webinars. What are we doing next week, Carla?
Next week is the ERISA.
We're going to be teaching about how to use federal law right here to stop carriers from recouping and how to make them pay when they don't want to pay by using the federal ERISA law. I've written books on it and we love that subject. And then the week after that, are we talking about Medicare?
Yeah, Medicare and its profitability.
Yeah.
Mm-hmm.
A lot of folks don't even realize in primary care, Medicare patients are 5 times more profitable than any other patient in primary care. Also, on the 23rd of this month, I am doing a killer, it's going to probably be close to 2 hours seminar on how to basically fight this whole thing that Cigna's doing. We're going to be talking about how to stop the carriers from all of these stupid requests that they're sending you for medical records, which often you're violating HIPAA when you answer those in compliance, send those to them. You want to make sure you're not violating HIPAA. And there's no reason for you to have to go through and copy a full year's record. So we're going to be talking about that as well. We're going to be talking about carriers like United Healthcare that's not covering everything they're required to and how to kick their butt. So that's all on 23rd. I'll send you an email on that as well. And we're going to be sending you all the slides from today out via email to you. This is also available, if it will be available on Paycom's website. Karen's going to be able to make sure that she gets this on Karen Blanchette, who is the director and president of Paycom, I believe. Well, she's the director of it there. And she's going to make sure that we have this available for you as well as Carla, so that you can download it later and let your provider watch it or your billing staff watch it if they have questions as well. Okay, so let's see what questions we have. Did I forget anything, Carla?
No, I think we're good. Yeah, we can open up the chat to any questions. If anyone was shy about going into the formal Q&A, now is a good chance.
And one other thing I'd like to pop out too. Some of you might not have heard of Paycom. You might have gotten an invite by someone else. Paycom is a professional association of healthcare office managers. They've been around since, if I remember right, January of '88 is whenever Richard started that right there. And they're an amazing association because one of the things as an office manager on any given day, you're wearing 42 different hats. At one moment, you're a scheduler. Next moment, you're the appointment of liaison. You're managing personnel. You're managing doctors. You're coordinating the doctor's travel schedule to go to their conventions. You're doing everything. And so that way it's why, okay, January 11th. Okay, cool. That's why you need help. And you need help with other office managers who knows because they're in the same position as you. So check out Paycom. Can you give us a website for Paycom's website for people to be able to get more information on there, Karen, please? Okay, so is this available for a neurology practice office? Yes. You tell me whether or not it's medically necessary for you to be monitoring in a neurology practice right here the patient's oxygen or their temperature or their weight or their glucose or their blood pressure, et cetera. And if there's medical necessity for it, and your doctor is willing to sit across the table from another doctor and show that medical necessity, this is why it's making a difference in my patients. Yeah, then that would be basically available for neurology. We work with all kinds of specialties. Yesterday, I was talking to a wound care practice. I'm sorry. Yeah, no, it wasn't. Yeah, it was yesterday. I was talking to a wound care practice. I never thought about it, and I'm looking now into wound care that checks the temperature and the moisture content of patients' wounds, of seeing if we can add that because that's a physiologic. So thank you, Karen, for posting that on there. What other questions do y'all have on billing, coding, coverage, et cetera, regarding remote patient monitoring? Do we have a question area, or are we putting it into chat, Carla?
We do have a question area. And Katina's question was, is it available for neurology practice, which we just covered?
Okay, I see it now.
So some people are asking questions in the chat if they're a bit shy in the Q&A. So Shannon just asked, is mental health covered? Maybe you can speak to that.
Well, again, we go back to the physiologics. Is mental health have a physiologic that can make a difference on them? I know if your oxygen level is not what it should be, then that can have a definite effect on mental health. I know that my mother-in-law, when she was alive, had UTIs all the time, and that definitely affected her mental health. So I'm trying to think as far as a physiologic straight from mental health, I'm not really sure there is one. But I definitely want to do some more research on that. I have a podiatry contact who deals with diabetes wounds all the time. Yeah, then definitely that diabetes makes a huge difference in any kind of foot care. Or even wound care, because if the patients if their diabetes and their blood sugars are not being controlled, then they're not going to have the kind of healing they need to have. Same thing with oxygen. If your oxygen content's too low, that's going to make a difference on the healing as well. And again, I don't have clinical training, folks, but I have been alive for 69 years and seen a lot. Sleep disturbance covered. Well, the thing is, people ask, what about sleep studies and sleep testing on the patient right here? Because you can buy those mats. I'm not sure that the mat, and that's why I haven't invested in the mats in my own company, by the way, is because I'm not sure that's considered to be a medically covered device by the FDA for the physiologics. Now, it might be, and I just haven't looked into it yet enough. That may be the possibility. Trinity, I would love to say I know the answer 100%, but I've learned back when I started this company back in 85, I said, if I don't know the answer, I'm not going to throw bovine fecal matter at you. I'm going to basically tell you right up front if I don't know. Okay. I like to make my grandchildren think I've got all the answers, but I really don't. Okay. Just ask my wife. She'll tell you I don't have all the answers. Mm-hmm. After 46 years of marriage, she knows. I appreciate y'all, folks. Let's see right here. I don't see any other questions. You do what the code says in 98975, 98981. No, I don't really get into remote therapy monitoring at all because that one right there, I decided to stay away from remote therapy monitoring because to me, this requires way too much time of the provider. Okay. When we see the CEUs for these sessions, Shannon, now the CEUs is for Paycom on this session, on these 30-minute sessions. These are not AAPC, and if I remember right, you're a certified coder, Shannon, because I've seen you in other groups before. Tiffany's absolutely right. None of us have all the answers, and we're human. Yep, and we make mistakes. That's why we need the Lord, because we're human. Still need the knowledge. Yes, ma'am. That's why we're doing this. Okay. Any other questions right here? Hopefully this has been helpful. Has this helped y'all today understand a little bit more about RPM? Good. Fantastic. I like seeing that. Mm-hmm. Now, sometimes you might have been using an RPM company in the past and things didn't work out the way that you really hoped for. Don't let a bad experience in the past with it kind of sway you from looking at it now. Like there is one company out there, by the way, that you must have at least 300 patients to be able to start doing it. We're not like that. If you have 20 patients you want to get started, man, we'll get you rolling. We don't have those high numbers of minimums. There's also a company out there, and I can't remember the name of that company, but they've got an 11-month exit strategy, meaning you cannot exit without paying them 11 months in advance for the average of what their fee has been for the previous 3 months. And that's outrageous that anybody would sign a contract like that. At Telecare USA, ours is really simple. We just If you decide you don't want to use us anymore, we don't want to keep you if you're not happy for whatever reason. So ours is a month-to-month basis. Can you reach out to Telecare? Yes, ma'am. First off, the easiest thing is just with a camera right here, or pull out your camera on your phone and take a picture of that screen, which is why I left it up to where it says scan me. Or you can send me an email, or you can go to telecare-usa.com and visit our website, and you can see all of our pricing, because we are probably one of the most transparent companies in the country. I don't know of any other company that puts all their prices and exactly how they work on the internet the way we do. People say, well, aren't you afraid of competitors finding you and copying you? No, because there's 1.3 million providers in the country, and there's nobody that can handle all of those providers. So we need the people out there that's doing it right. Is there a CEU that can be used for the APC on this? No, not for this particular one. This is a Paycom. You get a half a CEU on Paycom right here. And for this one, the one next week, and the one for the following week. Same, she says, same place, same time. And but we don't have these right here for the AAPC. What I can do is apply with the AMBA for billers, American Medical Billers Association, and see if they'll allow us to have credits. They normally give us credits whenever we meet their guidelines. And I know I'm speaking at their annual convention in October in Las Vegas. I think I'm speaking twice for them. Reminder to Paycom members, you get half CEU credit for each session. We have 3 sessions in the series. Same place, same time, next Wednesday. Okay.
Yeah, I just wanted to add for some folks that are that might be dropping off. We are at 35 minutes past, which is great. And by registering for this session today, you're automatically registered for next Wednesday and the Wednesday after. So we hope you can join us again. It should just be in your calendar, very straightforward. And there'll be reminders sent out as well the day before next Tuesday for next Wednesday session.
Now that's really cool, Karen. Karen said, I don't know about APC, but for Paycom, if your CEUs are relevant to your certification, we don't care where you got it. We accept other CEUs. That's really cool, because in your certification as an office manager, there's so many different capacities right there. It may be in the billing, might be in the credentialing, might be in the coding, it might be in contracting, or et cetera. So that is fantastic, except scuba diving. They're not taking scuba diving. Okay. I love that. Okay, so I'm going to ask you one last question right here, and let's see who knows the answer to this one. And toss in the answer in the chat area right here. How many animals of each kind did Noah take on the ark? Let's see who puts the first answer in here correctly. I see 2 and 7. I see 2s and 7s. As obviously 7 clean and 2 of each unclean. Okay. And by the way, if you haven't been to Noah's Ark there in Kentucky, it's an amazing experience to go to. Well, the correct answer is 0. Why? Because Noah didn't go on the ark. It was Moses that would go on the ark. It was Noah that went on the ark. Okay. But if you get a chance to go check out that, it's amazing. Almost 6,000 animals that was on that thing. Yes, ma'am, Karen. Trickster? Nah. And like Jennifer Hatton says, it is amazing to go see. You really want to go see that right there. Okay, along the same lines, I asked that, so we'll ask this one more question right here, and that is, how many states have 4 letters in their name? Look at that. Jennifer knew where I was going. So did Steve. All of them do. That's pretty good, because I know you right now, some of y'all are thinking Ohio and Iowa, but all of them have at least 4 letters. So that's cool. Any other questions right here? I don't see any. I appreciate y'all a lot. I really appreciate the opportunity to help y'all, and I hope that this has been a benefit. And we have also on the Don Self YouTube channel, we have dozens of free webinars on there on the different areas of reimbursement too. Well, Carla, anything else you want to add?
No, I don't think so. Just again, yeah, thank you for everyone who joined, and we hope to see you all next week.
I hope this has been a blessing to y'all, and I know you've been a blessing to me. And again, if you need to call me, it's 877 Don Self is the phone number. 877 DON-SELF or 366-7353. Thank you. And I guess we might as well close it up and say
Yes, thank you all.